Hello, and welcome to another episode of my podcast, The Global Agora. My name is Andrej Matišak, and I work as the Deputy Head of Foreign Desk in Slovak Daily Pravda, which, by the way, means truth, and it's not Russian Pravda.
Wanda Ferber-Brown is a senior fellow at the Brookings Institution, and we discuss how the fentanyl crisis has become the most lethal drug epidemic in the United States history. She examines the factors contributing to it, including the high potency of synthetic opioids and the role of criminal organizations in their distribution. Wanda also offers her insights into a recent decline in fentanyl-related deaths in the US and shares her concerns about the potential for a similar crisis to take hold elsewhere. So does she see any signs that Europe could face a fentanyl epidemic similar to that in North America? Listen to our conversation.
If you enjoy what I do, please support me on Coffee. For the link, see also a description of this episode. And now, up to the new debate.
Wanda is a senior fellow at the Brookings Institution. You run the series The Fentanyl Epidemic in North America and the Global Reach of Synthetic Opioids. First, could you briefly explain how the fentanyl epidemic affects the US and North America?
Well, in the United States and Canada, the fentanyl epidemic, fentanyl is a synthetic opioid, has become the most lethal epidemic in the history of the two countries. And frankly, it is possibly the world's most lethal epidemic. The problem is not simply that people are suffering from substance use disorder, that they are also dying at an unprecedented rate. And that's because synthetic opioids, such as in the North American case, principally fentanyl, there are other synthetic opioids, nitazines, that are starting to affect Europe, are enormously potent. So a very small amount is sufficient to cause an overdose and very potentially lethal overdose. These drugs have not as a result of the choice of users, but as a result of the suppliers, so the drug trafficking groups and distributors, become the dominant drug of consumption in the United States. So between 2012, when fentanyl first started arriving to the US market from China, from Chinese suppliers, to today, we have had more than 500,000 people dying in the United States. In Canada, the numbers are some 40,000 people. Canada is, of course, a country with much smaller population than the United States, but very high percentage rates as well. In the worst years, 22, 23, we saw, we saw more than 100,000 people dying of drug overdose, of which fentanyl was the most significant contributor. And in fact, we also started seeing that fentanyl is mixed into everything, into methamphetamine, into cocaine, into other drugs. Now, we have had improvements in the US since May 23, where fentanyl deaths declined. Last year, there were potentially 30,000 people fewer died of fentanyl. So we saw decreases, but we're still at the level where some 80,000 people are dying from drug overdose, the majority still as a result of fentanyl. Moreover, the improvements are potentially fragile. There is a lot of disagreement, many hypotheses as to why the fentanyl deaths declined. I have my views on what drove the declines, but a lot of it is potentially very ephemeral, especially as we are starting to see very different policies from the Trump administration. And my final point here in the introduction is that synthetic drugs are really sweeping global drug markets.
Yes, during your recent Congress testimony that I encourage every listener to read, and they can find a link in the description of this podcast, you said that the global drug markets are undergoing a synthetic drugs revolution that is significantly altering criminal patterns.
In the United States, this has been fentanyl. In Canada, this has been fentanyl. In Europe, as I mentioned, we are starting to see both emergence of fentanyl and significant expansion of nitazines, even more dangerous drug, but also methamphetamine. In the Middle East, in Australia, and New Zealand, in Asia, we see big increases in production of methamphetamine or consumption of methamphetamine. And we are even having places like Afghanistan producing meth. In various parts of Africa, you have all kinds of mixtures of drugs, some of which are synthetic drugs, including synthetic opioids. So the overall trend is very much toward shifting markets toward synthetic drugs. Now, when I talk with my Latin American colleagues and friends, they'll say, no, you're getting it completely wrong. Latin America's production of cocaine is still booming. We are still seeing close to, peak numbers of consumption in Europe, big increases in that. And that's undeniable. That's still fact. There is tremendous amount of production of cocaine in Latin America. There is still vast consumption of cocaine in Europe and increasing push by groups from Latin America to be expanding cocaine markets in the Asia-Pacific region, something they tried in the 1990s and the 2000s, and it never took off. But while I'll think that, yes, this diversification of the demand for cocaine is taking place, and while we still have high production numbers, the future lies with synthetic drugs.
So what is your theory? Why do you think that we are witnessing at least some decline of fentanyl consumption-related deaths?
There are multiple hypotheses that kind of range between focusing on changes in supply, changes in demand, and health policy measures that were taken really starting from Obama administration, continuing through the first Trump administration, and then becoming really intensified in the Biden administration. And my view is that the latter intervention is by far the most important, that it was the expansion of access to overdose medications and treatment that was the most significant change. Which is not to say that changes did not take place in the other sectors or in the other domains. And you could also have very strong cumulative effects, right? I mean, it would be foolish to assume that just one explanation is the sole explanation. Anyway, we are essentially running an experiment in the United States now.
What do you mean? What kind of experiment?
The second Trump administration has radically curtailed access to overdose medications and treatment. And so we will see whether we have big escalation of drug overdose deaths again. So let me go through the different explanation. And let me start with the last one that I was just speaking about. That, in my view, is really important, probably the most important explanation. That is that over the past several years, we really saw vast expansion of access to medications that reverse overdose. Naloxone is the medication, as well as medication that people who suffer from opioid use disorder can access at medical facilities. So a doctor can write them prescription that allows them to be using different drugs. Buprenorphine is one of them, or methadone could be another. And they get the drugs legally in a pharmacy, and instead of seeking drugs on the illegal market that contain fentanyl or are pure fentanyl, they use opioids prescribed by the doctor, so the dosage is controlled. This then, of course, means that people don't risk overdose. The prescription is controlled. The amount of the chemical components is highly controlled. Whereas if someone buys drugs on the illegal market, they don't know how much is fentanyl, how much is something else, how potent the fentanyl mixture is in it. I would also point out that even at the time when we have 100,000 people dying, the number of overdoses were many times that number. And the reason the lethal overdose ended up 100,000 is because people were given overdose medications that reversed it. And this was big change. One might think this is totally intuitive and this is what should be done. In fact, even in the early 2000s and certainly in the history beforehand, U.S. policy was highly allergic to providing overdose medications and to providing medications like buprenorphine or methadone. The theory was that this would only encourage more addiction, that if people found it easy to manage their illness, they would not be scared from using drugs in the first place. And I remember having exchanges with medical doctors, people who were working with people with substance use disorders around 2009, and they were just really desperate, some of them, that it was so difficult and close to impossible to be prescribing drugs like buprenorphine. But it has radically changed. And not only was there much more prevalent practice, and with something like naloxone became available without prescription, so people could buy it just off the shelf. You also saw very significant increase in insurance coverage for substance use disorder and mental health. And this is really fundamental in a country like United States, where you have no national health insurance and where people, even if they have health insurance, and these days everyone is supposed to have insurance, that was the consequence of Obamacare, that everyone buys some sort of insurance. The operative word here is that everyone has to buy it. And it might be available to everyone, even short of it being linked to employment, which is how most Americans access health insurance, that they have to buy it. And then there are two other mechanisms, Medicare and Medicaid. Let me just focus on the Medicaid, which is the insurance system that is available to people with the low income. And so expanding insurance coverage meant that both private insurers had to now include coverage for mental health treatment and substance use disorder, but also that Medicaid had to start covering it. And the vast majority of drug users in the United States are covered through Medicaid or have access to treatment of both issues, mental health and substance use disorders, through Medicaid. So the Biden administration put a lot of effort into expanding this coverage, demanding the coverage, bringing it to corrections facilities. The new budget bill that the Trump administration passed just recently has radically shrunk that coverage and has radically slashed the overall size of Medicaid and other issues.
Just to explain, it was the so-called Big Beautiful Bill, and Trump did everything to push it through the Congress.
The vast majority of drug users today in the United States will probably not be able to access treatment either for mental health or substance use disorder. Hopefully, this will not result in big increases in drug overdose deaths, but there is, in my view, very high chance that this will happen. And this is just one component of the budget bill. You also see the elimination of special medical facilities or special medical institutions, one of which is SAMHSA, that was the principal national institutions, not only setting policy for substance use disorder, but crucially funding it. It operated with a budget that essentially funded like the vast majority of programs at the county level as well as at state level for many states, that provided vast majority of funding for Native American tribes. So it was just like the predominant funding mechanism, and that's essentially completely eliminated. So a big change, a big shrinkage of resources applied to it. Let me a little bit reflect on the other 2 points that are the alternative hypotheses of why we saw deaths going down.
What are they? What are the alternative hypotheses?
So one has to do with the demand, that there are changes in demand, that people who were most susceptible to dying from fentanyl use have already died, and that today's users are less interested in fentanyl or are getting other types of drugs. Now, I would point out that the US market went through different changes when users did not know they were getting fentanyl. They did not want fentanyl. Then fentanyl became in everything. Some users started really liking fentanyl. But one of the changes that we see is that fentanyl in some parts of the United States is mixed with a veterinary tranquilizer called xylazine. And that's a very problematic drug. It causes terrible health effects. It causes necrotic tissues and often leads to amputation, so really bad outcome in terms of health. But it reduces the craving for fentanyl. So if people use a mixture of xylazine and fentanyl, instead of using 5 times a day, they might only use twice a day. So they're playing the roulette of whether they'll survive after the use only twice a day instead of 5 times, and that might be helping to reduce the numbers. We are also seeing, and that is a very dangerous trend, return or new growth of methamphetamine use. That's another synthetic drugs produced by the Mexican cartels and brought to the US. And the Mexican meth is the most potent meth in the world. And the level of potency that we are seeing today is much higher than the level of potency that was in the early 2000s or 1990s. So we have started seeing big increases in methamphetamine deaths because of the new potency. So maybe one type of death from fentanyl is now being replaced by deaths from meth, at least for some people. Those are the changes in the demand side. And finally, some are positing that there are changes on the supply side, that there was a supply shock and that supply radically shrank.
So on what is this claim based? What has changed?
There could be two mechanisms to it, one of which is that China took measures to start countering the supply of the basic chemicals from which fentanyl is synthesized in Mexico. These basic chemicals are called precursors. And China did indeed start doing that in 2024. And especially in sort of the second half of 2024 and at the last month, November, December, there were various indications that supply might be changing. You would hear Chinese officials saying that supply is down. You would hear U.S. government, Biden administration officials saying it. Perhaps most interestingly, cooks making fentanyl in Mexico were reporting that they were experimenting with all kinds of drugs coming out of China because the traditional precursors were difficult to obtain. So that might well have been that by the end of 2024, there is less supply, or at least less traditional precursor supply out of China. But that does not explain why the deaths started dropping in May 2023. So it's like a year and a half before that element of the supply side occurs, that the presumed change, that is the fact that the driver is occurring. The second possible explanation is that the Chapitos, that's one of the most powerful criminal groups in Mexico. So the Chapitos, the sons of El Chapo, who was one of the co-leaders of the Sinaloa cartel. And the Sinaloa cartel has three branches. The Chapitos branch is a branch that has been one of the principal producers of fentanyl. So the Sinaloa cartel, and specifically the Chapitos branch, and the second really important actor is the Cartel de Jalisco Nueva Generación. The Chapitos, because they were the principal producers and supplier of fentanyl, came under tremendous pressure from U.S. law enforcement. Indictments, arrests, intense intelligent efforts to arrest them. And in June 23, they issued a statement that they were banning production of fentanyl in the city of Culiacan, that's the capital of Sinaloa. I was there at the time when the first narcomantas, that's the term for the posters that the criminal groups issue and in which they communicate to the population, started appearing. At the time, there were many bodies, people who were murdered being found on piles of blue pills, which presumably were fentanyl, and they were, being widely interpreted that the Chapitos have banned the production of fentanyl, at least in the capital of Sinaloa, Culiacan. I was there several months later, and I kept hearing that the ban was still in place. But what I think also happened is that they moved production to other areas close to the border with the United States, as well as far away from the border with the United States, places like Chiapas. So there might have been a ban in Sinaloa, but it wasn't a total ban, because a year later, you have cooks in the city saying that they are cooking and they are just not sourcing. They are not using the same precursors. They have to be experimenting with precursors.
Do you see any signs that Europe can face a fentanyl crisis similar to the US? Do transnational criminal organizations view Europe as a potential market full of customers, if I can use words market and customers?
Yes, in my view, absolutely. And I would say that Europe is already going through at least some stage of synthetic opioids. And so one of the big disagreements is, will that escalate into really catastrophic stage? And I think there is high potential for that, whereas many of my European friends and colleagues believe that Europe will not see big problems, that it will be able to maintain the level of consumption that is taking place in fentanyl and nitazines at the current level, and that this is not going to result in drug overdose deaths. So let's talk about what's happening in Europe, and then, is it going to escalate, and what are the reasons why it could, and what are the reasons why it wouldn't. As of November of last year, so this is 6 months old now, 7 old months information, there were at least 22 European countries that were detecting fentanyl in the drug supply, in drug use, or at least as transshipment. And you had several localities like Ireland and Britain that experienced big spikes in fentanyl use that resulted in large numbers of deaths by the city for a temporary period of time, and then we saw it going down. In some cases, because law enforcement, as well as public health that really targeted that first outbreak. The most established markets for synthetic drugs are in the Baltics, places like Estonia, where fentanyl had been the predominant drug since the early 2000s, and then it was causing high overdose deaths. The market then stabilized, and although fentanyl remained the principal drug, overdose deaths remained much smaller. Estonia has recently seen a complete switch from fentanyl to nitazines, another form of synthetic drugs that are even more powerful than fentanyl. And so, an official would tell me that while it used to take one dose of naloxone to reverse the overdose, now it has to be several doses of application of naloxone to return the person to having respiratory system functioning. So it's certainly a concern there. But we have not seen anywhere in Europe sustained big increases of overdose. So we see spikes, they go down. We see supply increasing. The number of countries detecting is growing. Today, it might be more than 22 countries, but we haven't seen big sustained takeoff.
So is it relatively okay? And I emphasize the word relatively.
So my European friends and colleagues who think that Europe will not have, even down the road, a big synthetic opioid crisis, think they put sort of three explanations forward. The first explanation is that users in Europe are interested in cocaine. They are not interested in other drugs. Cocaine is the drug that's really peaking in Europe. Perhaps my counter to that would be, well, that doesn't account for why it took Europe so long to become interested in cocaine. Cocaine in the United States took off in the 1980s, and you have essentially 15, 20-year gap in Europe in which there was this constant puzzle. Like everyone was asking in criminology in the 80s and 90s, why the US does coke and why Europe does heroin, and why don't we see the emergence of large cocaine markets in Europe? And the answer that was very frequently given was, well, the Europeans have a taste for heroin, they want depressants, they don't want stimulants. Sometimes this was attributed to different cultures in Europe and the United States. But there was a notion that somehow European users are interested in that particular drug, heroin, and not in coke. And then, all of a sudden you have this big growth of cocaine use in Europe in the 1990s. And that had nothing to do with changes in user preferences. Well, nothing is too strong about that. That didn't have that much to do with changes in users' preferences, and a lot to do with choices that suppliers were making. And so I think that the view that assumes that there is just different taste and preference in Europe does not fully recognize the criticality of how supply drives changes in use.
Does it mean that the supplier's choices are changing everything, affecting everything?
In the United States, it was not that one day users started demanding fentanyl. It was that suppliers, both groups in China and eventually the Sinaloa cartel and Cartel de Jalisco Nueva Generación, just started pumping synthetic opioids into the United States, because synthetic opioids and all synthetic drugs are enormously advantageous for traffickers. They are much easier to deal with, to evade law enforcement, to produce than plant-based drugs. And so, yes, you still have these huge legacy drugs like cocaine, where criminal groups have vast investments. It's hard for them to just completely write off their vast investments in coke. They still have an interest to bring it in and to do something now that they control these coca fields and they have invested in tremendous amount of firepower. We don't want just to say the hell with it. We are just liquidating all of it. But the resources needed in terms of firepower, smuggling, logistics, evading law enforcement production for synthetic drugs are just so much easier that the drive is overwhelming for criminal groups to be in synthetic drugs as opposed to plant-based drugs. The second reason people in Europe sometimes put forward about why Europe will not have a big problem is because, okay, even if suppliers start bringing in synthetic opioids to a large extent, European users are smart. They'll avoid it, they'll stick to other drugs. Why would they use highly potent meth or nitazines or fentanyl when they can access all kinds of designer drugs, ecstasy, or when they can have cocaine or heroin? The users will just stay away from it. And also, Europe has far more extensive harm reduction measures. Access to medications is easier. Access to drug testing is easier. And Europe has national health insurance, so users will be able to access treatment.
The argument about users avoiding fentanyl sounds to me as a bit naive, but the fact is that the healthcare system in Europe is really different than in the US.
So I do believe that harm reduction practices, access to health insurance are all very important, and access to treatment are all very important for bringing overdose deaths down. I don't believe they are a strong deterrent from developing substance use disorder in the first place, or strong mechanism for developing substance use disorder in the first place. And in fact, Canada, and specifically British Columbia, is one of the places in the world that's been a pioneer with harm reduction, that has invested very extensively in harm reduction. It these days have on a small level also not just harm reduction, but something called control supplies, where users can access drugs through government. So instead of buying, again, drugs like fentanyl on the illicit market through the government distribution, they will access a different substance that will not lead to overdose. The scale of that coverage is limited compared to the numbers of people that are using, but it's been a pioneering program. But with all of that, with all the resources, all the innovation, and just much greater social acceptability of harm reduction than in a place like the US, British Columbia has been one of the worst hit places in Canada with fentanyl, and they have had very large drug overdose deaths and really difficult fentanyl situation. And we are now seeing fentanyl spreading far out of Vancouver and British Columbia to across Canada. So, extensive harm reduction resource, far more so than in other parts of the world, still ended up overwhelmed by the fentanyl crisis when it started hitting. And the final issue here is the one that I would focus on, that it really matters who and how the supply is occurring.
So what do you see on this front?
The fentanyl was initially supplied to the US by Chinese criminal networks that might be small mom and pop networks. They would be called cartel, terms like the Zhang cartel. But it was essentially a family operation of about 8-10 people. Sometimes the networks were even smaller. And they were shipping fentanyl directly to buyers or producers. But one of the big jumps, or core big jump in drug overdose deaths, was when Mexican cartels started buying fentanyl or precursor from the Chinese brokers and started on an industrial scale producing it and bringing it to the United States and really pumped it into their drug supply. So the role of very large, powerful criminal groups was fundamental to just see massive escalation of the supply and use of fentanyl. And Europe has a large number of very large, powerful criminal groups. So it appears that fentanyl and nitazines are mostly supplied to Europe from China and India, still at the level where the United States was in 2012, 2013, 2014. So these are fairly small networks, kind of producer broker directly to a retailer. It doesn't appear yet that we have seen the Italian mafia groups and Turkish, Albanian mafia groups or Russian criminal groups extensively get into it. But I think if that happens, then we will see just massive escalation of drug overdose and real challenge for both law enforcement and public health. Two other ending comments here is the growing role of Mexican cartels in drugs in Europe is a big problem because they are a very likely vector of introducing either meth, including highly potent meth, or expanding the presence of fentanyl. But the pioneer in Europe, the Sinaloa cartel, is going through internal warfare that's hampering its international operations. It's not preventing them, but it's impinging on them. The internal warfare is completely consuming the cartel since the fall of 2024. There might not even be a Sinaloa cartel anymore. There might be just distinct factions, 1 or 2 or 3 or several of them. So that has kind of put a brake on the expansion of the Mexican cartels in Europe, in other parts of the world. The second cartel, Cartel de Jalisco Nueva Generación, is involved in the warfare. It's trying to eliminate its rival and siding with one branch, the Chapitos, which is pretty extraordinary. It's kind of like if the West Coast seceded during Cold War and joined with the Soviet Union against the East Coast. That's kind of what's going on in the Chapitos Cartel de Jalisco Nueva Generación presumed alliance. But that's kind of putting a brake so far on how synthetic drugs are being pumped into Europe. And my last comment here is that the supply, I spoke several times about the supply of and use in the Baltic states, where it has been long established, highly lethal. We also saw about a decade later, around 2007-8, a supply of fentanyl emerging in the Nordic states, and the Nordic countries were well capable of crushing it at the time and preventing the supply, and that saved a lot of lives. Now, these were probably fentanyl supplied out of the former Soviet Union space. So it's not clear where the fentanyl was being produced, but it was not linked dramatically to the supply from China and India, which is the dominant source of either finished nitazines or today or precursors for them. And it also, in both cases, it did not involve the large European organized crime groups. But again, one could even imagine Russian organized crime groups picking up that production and really making it a big effort to supply these drugs to Europe, including because they might believe or might be directed to be serving the state that way. The Russian state in its confrontation with Europe. And of course, we already see significant increase in relations between Russian espionage services and Russian criminal groups, and the use of criminal groups for state purposes. So bringing in a lot of fentanyl might be a big mechanism of funding, both not just for the criminal groups, but for specific espionage operations as well.
This was another episode of my podcast, The Global Agora. Subscribe, listen on Spotify, Apple Podcasts, and on the other platforms. If you enjoy what I do, please support me on Ko-fi. For the link, see also the description of this episode. Thank you for listening and stay tuned.